Hello, I'm Scott with Great Lakes Seminars, and I'm here to show you the inferior glide of the patellofemoral joint. We show this in the comprehensive knee class and find great success with it. We can do this technique really for anybody who is lacking knee flexion. If it's a total knee replacement, if it's a ligamentous instability patient, if it is any kind of post-op, really, if you are just looking to gain knee flexion, this is the first joint that we like to go to gain that flexion. Really, because if the patella does not glide inferiorly, that can inhibit the ability for the entire knee to flex, including the tibiofemoral joint. So we start here. Scoot over here towards me a little bit. So I'd like to get the patient nice and close to me. And then I'm going to take my caudal hand, take the fingertips, laying them right on the superior border of the patella. My palm is going to go right over that. And then from there, we're going to side bend caudally. Okay, so we are inferiorly gliding the patella. As I bring it down to the end range, I can oscillate 1 to 2 per second for 10 seconds. Oscillate, 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 and then we're going to hold it inferiorly, and I'm going to have the patient dig their heel into the mat for a muscle energy technique. So they dig in for 10 seconds, for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax, and then I repeat for 10 seconds, 1 to 2 per second for 10 seconds. I hold, and then repeat. We can do that for 4 or 5 cycles, and then reassess. The couple nuances with this technique is that you want to make sure that you're in the joint range or in the joint plane. So if the knee was all the way up like so, my elbow would be a lot higher. If the knee is lower, I would be more in the horizon like so. If they're just coming out of an immobilizer and they have almost no flexion at all, you can really just use your web space and perform the inferior glide in that manner. A couple things that can inhibit an inferior glide would be a restriction in the articular genu, any scarring in the suprapatellar pouch, or really any scarring around the anterior aspect of the knee, so porthole scars or that total knee replacement scar. So those are things we would definitely want to address to make our technique a little bit more successful. I hope that helps and hope that we get knee flexion with all your patients. Have a good day.